So, okay, okay. Sorry, I probably talked too fast. I will slow down.
So my name is Osama Michael. I'm an optometrist with a background in public health. I currently work in health and social care in Wales. So I'm part of a body called Rural Seed, under Rural Roncal, where we advocate for improvement in rural healthcare all over the world, not just in NHS, all over the world. But firstly, before I start going and talking about lots of stuff, I just want us to introduce ourselves and talk about this, our background, what we do, where we work, stuff like that. Just simple, keep it short, it doesn't have to be so much. So we can just start with Amber. Okay. Amber, I think you're mute. Hello. Okay. So I'm Dr. Amber. I'm a family physician in the British Virgin Islands. I train in Wales. I did my medical school and my residency and my GP training. I'm currently working in a rural and remote area in the Caribbean, and I'm one of the founding members of Rural Seed, and I'm finally retired this year. So I'm very much looking forward to this conversation. Okay, thank you so much, Amber. So let's go to Akiri. Hi, good evening. Dr. Akiri. I'm an optometrist, currently working in obstetric clinics in Ibadan. Yeah, an educator. Yeah, a clinical optometrist. I'm a researcher, and what else? I just got that basic stuff. Okay, thank you. Okay, it's Faith. Good evening, everybody. I'm Presty by name. I'm an optometrist. I'm currently based in Wales. So I think that's about it. Okay, thank you. Lizzie? Lizzie, can you hear me? Okay, let's just go to Ines. Okay, Ikene, can you hear us? Yes. Hello, okay. Please could you just introduce yourself to everyone, so get to know you? Hello, can you guys hear me? Yes, we can. Oh, okay. My name is Dr. Michael. I'm an optometrist, and I am currently working in Ibadan, in an eye clinic in Ibadan, in Nigeria. Thank you. Good to meet you. Yeah. Okay. Ines? Ines, can you hear me? Okay. I'll just wait for her to get back to us. Okay. Okay, so first of all, I'm really intrigued that you guys found my invitation and came up online. And also with the change of location with the things, but some people probably not be able to make it. I know, but we just have to do what we have. So first of all, I'd like to just introduce Rural Seed to everyone so we get to understand what Rural Seed is all about and the aim of this discussion. So Rural Seed is a passionate body under Rural One Card dedicated to advocating and improving rural health. And the mission is mostly to enhance rural healthcare delivery in rural areas where there's challenges such as limited access to medical facilities, scarcity of healthcare professionals, socioeconomic barriers. Although most recently rural areas have been improving, they've been trying to make efforts towards reducing governments have been trying to make efforts towards reducing barriers associated with living in rural areas and accessing healthcare, but there's still a lot that needs to be done and there's still a lot going on that people don't really still know about that is ongoing in rural areas. But that's where Rural Seed comes. We're trying to advocate for this improvement and make a change. So today's cafe is not just a discussion, but a opportunity to bring people from diverse backgrounds, diverse health backgrounds to talk about their experience. Maybe you've worked in a rural setting before, the experience you've had, and maybe how you've overcome before. Also, getting ideas, being in different rural area, you think about something like, if this could be possible, I think if we did this, the rural healthcare would improve, and stuff like that. So that's why we're having this discussion to get ideas that I can't think of, but you've thought about at one point or another, and you want to share with us and say, okay, probably if we come together with enough finance and backing, we'll be able to carry out this improvement and change, make a lot of changes in rural areas. Okay, so first of all, I'd like us to just maybe first of all, after identify the barriers, without many barriers, we can think about the strategies that we need to deploy to these rural areas, be it in Wales or Nigeria. So we've talked about the barriers that we face. I will talk about barriers from my experience. People have barriers based on their experience and what they've gone through or what they've experienced where they've worked. So I worked whilst in Nigeria. I worked in an eye clinic in a rural setting in Benin, in the local government area. So although we provided eye services to people, but most of them that came around, they wouldn't even know about these conditions. They wouldn't even know what they had, or that they had it for a long time, or that it was hereditary, or that they could get blind from it, stuff like that. They were not even aware. And so for me, in that instance, awareness education was a barrier for them because first of all, most of them access to good schools or listening to school was a problem. That's where finance is coming into it. Most of their parents couldn't even afford to send them to school, so hence they are not even educated enough to know what's going on. And then following social media or adverts or stuff that awareness that is needed online, they probably can't follow it. So education was awareness and literacy was a huge barrier for accessing healthcare in the area where I worked. So I won't talk so much and say everything. So I want to get everybody to talk about something. That I don't get to do all the talking discussion. Okay. So I just go around and maybe you just talk about the barriers you face or a colleague that you know or someone has experienced in a rural area, and possibly if it was you that had that faced such barriers, how did you overcome it against that or were able to do to overcome them? So Amber, yeah, you happen to be closest to me, so I'll keep going to you first. So please, Amber, if you'd like to share with us. Yeah, right. So the rural areas where I work in actually made up of 4 islands, so only one of them has a hospital. So our biggest barrier to healthcare is actually getting people access to healthcare. So most districts have a primary healthcare center. Some of them are a little bit more capable than others. Like the one on my island is also an emergency center, so we can do IV fluids and that sort of thing, minor procedures. But a lot of the other islands really can't, like they don't have x-rays or they don't have a pharmacy or whatever. So getting people access to the hospital is a huge problem. From my hometown, it's only by boat that you can get there, and then from our most remote island, it's only by plane. And it costs money, the government doesn't pay for it. So $400 for the boat, and I think $700 for the plane or something like that. Oh wow. Yeah, so you can imagine, if you're in a car accident in my hometown and we don't have x-ray, because they only work twice a week, so we don't have x-ray at that day, then you're paying $400 to go on a boat to literally get an x-ray and then come back. Finances is another huge problem, so we have a semi-privatized system. It's expensive. And if you're not from here, it's 3 times more. Okay. Another barrier that we have is, as you said, a lot of education. So the general population is fairly well educated, but they don't often understand. Okay. They don't often understand how our healthcare system in particular works. So they don't don't know how to access physiotherapy, they don't know how to access emergency care. A lot of people in the community don't even know the number for the ambulance because it's not 999. And they don't really know how it works. And sorry, especially in emergency sector, it can be quite difficult. And then basic things like either teaching or education. A lot of the parents in the Virgin Islands don't want the school to teach their children about sex, so they actually managed to lobby the Ministry of Education to remove it from the curriculum. So we don't have any sex education at all. Yeah, so sorry about my dog. So that has resulted in a lot of problems, including an increase in teenage pregnancy and an increase in sexually transmitted infections as a result. And it's very difficult to then try and support these people when the damage has already been done. We also don't have staff, which is, every rural area has that same problem, so we're very limited in what staff we have. Staff are frequently asked to do extra shifts, and there's increased risk of burnout and all of that good stuff. Thank you so much, Amber, for your contribution. Okay, so I feel we want to share something with us. Experience or any ideas of how that is any barriers people face in rural areas. Alright, thank you very much for the opportunity to speak. Concerning barriers, I've worked in the area before during my internship days. I worked there for about a year and 2 months, to be precise. It was in a state where I never grew up from. I'm from a distance, I speak Edo, Ishan, but I had to go to the eastern part of the country where they speak Igbo, and the communication was actually one barrier. Right, now, in terms of the indigenous of the community itself, understanding what kind of condition they have was even a problem. Some of them had an idea that something was wrong, but they did not even know what it was, and they did not even know how to get access to be able to, get treatment for whatever the issues they have. Now, we have spoken a lot about the financial barriers, so I'm not going to be talking about that because obviously, in our settlements, they had financial issues and all. But another thing that was also a problem was sparkling, if I may use that word. Yeah, sparkling was something that actually had big issues there because most of the facilities there, they were actually not employing qualified personnel, not because they were not, but because they could not afford it because of the cost of maintaining the personnel themselves. So they had to resort to, hiring lower workers just to help supplement the few qualified staff that they could get. So that was also another barrier there. And their ability also to accept some form of treatment was also something else. Yeah, some of them, especially the few of them that had, because of them, most of them actually had cataract. Initially, it was a big issue for them to uptake cataract surgery, as most of them were adamant and depending on one means or the other concerning if you do surgery, you're going to get blind. They know somebody who had surgery and they could no longer see, not knowing that there are different things associated with it. But at the same time, you would observe that these same people would go and meet a local physician who would perform what is called catering for them, and some months later they'll come back to the clinic with severe pain and all. So you now have to manage. So I think that was another barrier that was faced there. And currently now, okay, I'm not in the rural area per se, but then again, the area I am is a town, but though they are educated in the place, yes, I'm in the authority, though they are educated, but yes, you come to find out that the education does not actually translate to their uptake of eye care services. Yeah, you'll see people who struggle to see, and even some of them, they notice that their children are going very close to the television to see. And when they come to the clinic, why you tell them that the children need to get better, especially to let their parents tell you, no, you can't get any glasses and stuff like that. And some of them, at the end of the day, when you take it, you don't even use it for long, because they're expecting that using the glasses, their eye problems are basically after she the other using the glasses. So, overcoming all of this, one major thing that I always do, I like documenting, I like educating my people, so I always take my time to take to make them understand the importance of what they are being given and how it's actually going to influence them. Yes, the money is actually a problem for them. So, I think I will put it stop here. Those are not the benefits. Let's just for my attention. Thank you so much. Okay, just for a so we can move on to the main discussion. Does anybody have something they would like to share concerning the barriers? Anyone? So, just some of your light speech. Yeah, good evening, everyone. Good evening. So, thank you so much for the wonderful discussion. A lot has been said regarding practice in rural areas, but I would like to extend it a bit to third world countries, and of which I live in one and practice in one. So, basically, generally, it's not just a rural area issue because most times when we talk about rural area, we can be saying but we may not get it all correct because rural areas in different economic zones and in different countries differs. So the challenge is that a rural area in the US will have are definitely not the same challenges that a rural area in Nigeria will have. In fact, the health challenges, or rather the barriers to health to adequate health service uptake in the US is definitely not the same as the one we even have in urban cities in Nigeria. So I'll speak on general notes. Currently, where I practice is I practice in it's a developing town. I would say a town. I would say a town. It has moved from being a rural area to being a town. Although the characteristics of the ruralness is still there. It has not really diminished completely. Yeah, still there. So basically the challenges we have and the barriers to healthcare services include poor government funding and unseriousness from the part of the government because hello, can you hear me? Yes, we can. Okay. So as I was saying, one of the challenges that we face in Nigeria per se, so like I said from the beginning, I will not be restricting what I will say to the rural environment. One of the challenges we face is poor funding of the health sector. And then another major problem is the Japa syndrome that has now gripped the country due to poor leadership and lackadaisical attitude of the political class and the political establishment. So a lot of healthcare providers are leaving the country and a lot are still on their way to leave. And nothing is being done to at least encourage them to stay. another issue is security. We may think this as we may ask ourselves, how does security affect healthcare delivery and healthcare uptake? We are currently faced with the worst security crisis ever this country has ever faced in her history rather. You can't move from a spot to another spot without being kidnapped. That being said, other doctors, specialists are being kidnapped. I read online the other time that the only professor of neurology in Cross River State Teaching Hospital was kidnapped. Just some days back, another doctor was kidnapped in Kogi. So if you heard all these stories of kidnapping, and these persons being kidnapped, they have specialties. For example, I am an eye care, a primary eye care practitioner. So there are sometimes I may come across certain conditions that may require me to quickly refer the patient. For example, a person comes in with classic signs of intracranial aneurysm. I may not have to even seek the ophthalmologist's attention. I may have to write a letter immediately and refer that such a patient immediately to neurosurgery. If I refer that patient to the only center that is having a neurosurgeon and the neurosurgeon has been kidnapped, that patient will eventually die. So these are the problems we are facing, and they are serious problems. They are not just basic problems. So because of time, I will just stop here. Thank you so much. Thank you. Amber, you have something to say? Yes, this is all new information to me. So, is it kidnapping like they're targeting medical professionals because they might get better pay, or are they just kidnapping everybody and it just happens to be affecting? I think initially it was really for they were targeting rich people, professionals, or doctors that they assume have money, but now it's not because almost everyone. They just kidnap everyone. And do they come back? Some do come back. So that's a very unique challenge. Yes, it is. Security. Sorry to cut you short. I just to interject. Just last 2 weeks, 19 students from University of Maiduguri and Jos that were going to Enugu for a religious program. 19 students, 19 medical students, and a house officer were kidnapped. Although they were later eventually, I don't know, released, rescued. I don't know the term to use because the story is not very clear. But a lot of doctors have actually died in captivity, so is that bad? You know, it's strange how we have the name because of country to someone who find very happy. So it's crazy also. Thank you so much, guys. So for lack of time, so I was going to give everybody the opportunity to talk about the strategies or what they think. Although all these we're facing all these challenges, different insecurity, finances, or what do us as individuals? Like let's say we want to do something for the community. You see a community that they are not going to school or finances the barrier or the distance to the health center is the barrier. What do you think we can do at the community level just within ourselves? We cannot really rely on government to do everything at every point in time. So let's say within the community we want to make our intervention. What do you possibly think we can do that can work? That without really needing the aid, just if a body just sponsor an NGO, something without government at the community level that can work to improve healthcare. So I'm going to split us into a group. Yeah, so I'm going to split us into groups so that way we just share our ideas in a group about 5 minutes. We'll talk about the ideas in a group. Then one person just picks up. When we come back to the normal, there's going to be a breakout room. I'll split you guys into different rooms. So you guys discuss between yourselves what you think would be the best idea. And then we come back. So you just pick a dedicated, I'll just pick an idea for each of your group. And then you can share your idea what you think, what's the best strategy you think we can employ to improve healthcare at the community level. Okay, do we understand that? Like, do we understand the plan? Okay, Amber has one. Yeah, that's how. Do we understand it? Just unmute and say yes. Yes, I do. Okay, that's great. Yes, I do. Okay, thank you very much. Okay, alright. So I'm going to quickly and split everyone into rooms. Okay. Yeah, hello, good evening. I'm not sure how many of us will be in a room, but I don't think it will be that many. Yes, I think so. Because I think it's just stuff as I left from now. Okay, so we're talking about strategies that we think will work. Yeah. Alright, will you go first? Yeah, sure. So, in the setting that I've worked in, what I have discovered with primary care in particular is that the management often causes huge barriers. When I have tried to involve them in different strategies, I haven't been successful. In fact, there's been a hindrance. So, the strategy that I have used is by making sure that I educate patients in the way that they can understand it very easily. So, for example, I will put information in church bulletins, or I will come to like the private schools or the public schools, or disseminate information through WhatsApp or social media, which they tend to be a bit more receptive for. So, one of the biggest issues is that they don't really understand how to interact with the service so that it can work for them. Like, when to call for help, when to go to the clinic, how to get medication, all of that. So, I try to educate them on their benefits and how to access the service. Whenever I meet them, I just try to repeat the same message consistently so that at least it will slowly spread throughout the community so that we can actually take care of each other rather than relying on management or the government. And that's worked quite well, having that bottom-up approach. And one of the successes of that is that it actually pushed the management team to act accordingly. So, like in the Virgin, you have the Virgin Search and Rescue. They have an actual emergency boat. The boat that the healthcare system uses is a fishing boat. So, to try and get the health service to invest in an emergency boat has been like a 10-year battle and we've never gotten anywhere. But I've been able to educate people about the search and rescue so that they now utilize that service a lot more. And it's caused the government to start to look at investing in search and rescue rather than using the fishing boat. Yeah, that's actually a nice one. And I think in cases like that as well, do you involve other people with you? Because I think if you involve others, it would also help. Because like here where I work in Nigeria, non-current parties happen to be the parties in Nigeria. And so part of what we do on a yearly basis is every little opportunity we have, we use it to offer free eye care service to our clients. Now, and this time it's not just our client itself, but also to every other person that needs the services. Like, okay, currently now, just from mid of this month into the whole of September, we are running a program called Back to School Promo. It actually helps to encourage people to get glasses for their children who actually need it. So that way, they pay less the amount for what they are supposed to pay just to get it. In other public holidays, I won't go to work in public holidays because I'm in a private setting. So in those public holidays, we actually offer free eye care services to the clients. They can come in for free consultations, and all they need to do is just to get, if they need medication or whatever, then they get it. And in my own little way as well, during my parties, I try to do one thing and not just focus on do your test for patients and then let them go, but rather I invest more in educating them. Because the truth is, if you can educate one patient effectively, that patient can become your mouthpiece outside. and then it becomes easier. So that's actually one thing I leverage on because I do not have enough time to really go out. But once in a while also, when I have opportunities to go out for outreaches, like I think within a space of 10 months I've gone out twice to two different locations. One was in rural area entirely, then the other one was also a ministers conference. So I had to go there, did training for them, give them head talks, and just to ensure that at the end of the day we're able to do the little we can. So I think if that can also help. Well, if sponsorship were to come into place, it's actually something that I don't mind. I would have actually dedicated, even if it's one of the Sundays of every month, to actually go to these rural areas and help them out. But the truth still remains that while you work for someone or while you're working for people, there's little you can do. Because in as much as you want to do much, you have the limitations. You can't do so much and then be stranded. It's going to be so much at the end of the day. So I think that's another approach that I use, and I think it would also be helpful as well. So do you have more to add? No, okay. I think actually can put a little bit. Okay. Right, Ekene, you can speak.
I've had experience working in rural settings. I've worked with residents that are guided with the communities that like the rural area, especially in rural area, and I think the major challenge that problem is access, like having to commute from one place to another in an environment that is very difficult and very challenging. I remember having to keep patients in how to care, and then process tertiary that provide them not needed located miles away or thousands of money away. Imagine an emergency for the patient needs to go to immediate access, but that's quite challenging. So in rural settings, I think access is one of the things that point out. The access and the problem was skilled experts in the very readily available to this area. Our movement there is periodic. You're there for a while and go out. Now, wouldn't it be better if we had a resident skilled workers in a reduced environment? Because I noticed that most of them have to rely solely locally trained, applied, questionable means, providing specific patients. I remember then how times when you're out, to come back, to have patients there that is only managed. They have to manage the existing condition and post effects of poor management. It becomes more combative. So I think those two things are challenging together. So how do you resolve them? Well, in a much grander scale of things, now with the state it's more the government aspect. So access to these areas, especially as prepared development, which can be provided, which may only be provided by the government. But then again, I still think there are certain things that are going to be able to do. Maybe you're going providing both in environment areas and then on land areas where that the road network is poor or the offer grading services in the road, right? And then in terms of skilled workers, well, setting up structures where you have periodic. When I see what periodic, I mean, well, if the person is not resident, but how would you have someone who, you need to take technical, if the living conditions is very right, but you will find it skilled workers next to you. Because I remember the harsh conditions had to provide poor water, those is a challenge. But I think solving things like that is the partial amount of it involves making sure that whatever resident self-skilled worker that this in the environment is comfortable, and then have a sort of a history system. So, yeah, I think that's my take.
Thank you. Thank you. Sorry, guys, I know I missed a lot of the conversation. Well, has both sides spoken on the Amber?
No, we haven't done our sort of talking about what each group said as yet.
Okay. Does the meeting close by the exact time, or it's the longest?
I don't think so, because it's it's a paid account, so it shouldn't just shut off automatically.
Okay. All right. That's great. Okay. So from the breakout room, what group were you? What room were you, Amber?
I was in room 1 with Dr. Akiri and Dr. Akinde.
Okay. So what did you guys come up with? Akiri, what did you guys come up with?
All right. So we
Sorry
actually
to cut. Sorry, let's just be as brief as possible so we could just take the time. Thank you.
all right, no problem. All right,
Okay.
so what we basically spoke about, we shared our own insights on how we have been able to, help our community thus far. And one of them was first communication, and enlightening the general public, either via WhatsApp or via putting information in church bulletins, or even via educating the patient that comes into the clinic to see us. So that was one way. And secondly was actually going out for health talks as well, and outreaches at the time that is available for us. And thirdly, we also spoke about trying to use our establishment where we work to also provide free eye care free services generally for people at some specific period of time, probably during celebrations or thereabout. And lastly, if there is sponsorship, we can actually get involved in a once in a month outreach program to these rural communities. So I think that's a summary of our discussion thus far. And okay, I think there's a part I almost forgot, trying to still see how, if it's possible to invest in, access to healthcare. If the government cannot do that, then if we have sponsors that can do that, then that would also be another way for us. So I think that's a summary of our discussion and our conclusion.
Thank you. Thank you so much, Akiri. So from the other breakout group, what did you guys have from the other group? Anyone from the other group?
Okay, we were not able to come up with something before the meeting ended because of, I think, probably network. But I think a way forward without the government assistance, a way forward is to go into local communities and organize maybe a meeting, maybe using their town hall, a town meeting, and then educate them about the common health problem, common health challenges, public health
Yeah.
problem, things like hypertension, diabetes, glaucoma. These diseases are very common, and usually people don't know when they have it, and it usually causes a lot of problem and causes a lot of dependency when when they begin to cause end organ damage. So I think that's a way to go about it. More so, or rather, moreover, when these talks or these meetings are organized with the help of the town leaders and the community leaders, it will also be beneficial if a screening is done, a screening test is done for everyone. That's a way, that will give a head start to every individual who is having a serious problem, and we also enable them to take charge of their health. Then another thing is education. Education is very, very important in health. In fact, health requires the effectiveness of any management most of the time requires maybe 70 to 60 to 70% expertise of the health practitioner and 20 to 30% of the patient's education and seriousness of his or her own condition. So educating peer persons who have been identified to have this common health problem that may lead them to become dependent, like some of those diseases that I have mentioned earlier that can make people dependent. Diseases like glaucoma can cause permanent blindness, irreversible, and then make them dependent. These type of diseases, they need to be appropriately counseled and made to follow their medical care provider as at when due and obey all their instructions. Then thirdly, I think it will be beneficial if like what Dr. Akere has said earlier, if they can have, or rather if they can have the involvement of certain individuals who can actually sponsor some of these things. For example, they can sponsor drugs. In Nigeria currently, drugs are very, very expensive. Augmentin is, I can't remember the last time I bought Augmentin or prescribed it for anybody. I only prescribe it only when there is a sensitivity test. That's to tell you. Then when there is a culture and sensitivity test that um that supports its use or provides an indication for me to prescribe it. Otherwise, I don't. Before, Augmentin used to be something we prescribe. Basically, when you suspect a gram positive organism. So it's very expensive now. So if you can have people to fund drugs, I have patients now that have been lost to follow up. A lot of them actually. I have one woman I can remember her. She's a teacher. She had end-stage glaucoma, and her glaucoma is the type that they can't do surgery basically at that stage. And then when this guy entered that Rock, she stopped coming for checkup. She stopped coming for checkup. And I'm very, very sure she's not seeing again. I'm very, very sure. So if they can sponsor drugs, glaucoma drugs, these things are things that they are like essentials for these people, but they are extremely expensive now. Travel pros is over 8K. Imagine you are buying that 2 every month or 2 in every 45 days. And that's not the only drug you'll be buying. So I think sponsorship is highly recommended. And then another thing is, if you can get a group of medical experts or medical practitioners who will be willing via an intercessory via an intercessor, meaning somebody who may not be a medical person, a medical personnel, but the person will just stand as a middleman, while the medical practitioner can consult via telecommunication, meaning they can consult online. You understand? And these are ways that we can address some of these complaints, or rather some of these problems, without really getting the government involved. But to crown it all, um, the best way to address problem is usually from the root cause, and the root cause is to call out the government and make them realize the damage that they are doing to their people. I think that is the best way to solve the problem. So that will be all for now. Thank you.
Thank you so much again. Thank you. Thank you all for your contributions. You've thrown light on so many things we probably have missed. So thank you so much. I'd like to also share mine. Okay, my audio seems to be off and on again. Okay, but okay, great. Okay, so I'm currently in Wales. Okay, I know a lot of people just think because we're in the UK, we don't experience the rural areas of the UK do not experience their own challenges. They do have their own challenges, and just like Ikedi said, there are different challenges based on your area. There, so currently in Wales, I can speak for let's say Brecon Hill or some areas of Wales where people stay in these hilly locations. So accessing healthcare, it poses a great challenge for them. So therefore, when they consider the fact that how would they get down from that very location, that heat up, and they're like trekking down, they won't want to bother. They would miss their appointment. They will not go for their checkup. When they consider the distance they have to move from their current location to go accessing that healthcare. So even though the healthcare is available, they will still not even go and access the healthcare. So that is also a challenge they are facing in those rural areas of it. So accessing the healthcare or uh not all healthcare is free in the UK. For example, seeing the opticians or using the dentist, you'd have to pay for that. So when they consider the money they would want to spend for such things, finance also becomes a barrier for them. So if it was, let's say, just to say GP, that will be free. It will be covered in the NHS. But then stuff like seeing the opticians, seeing the dentist, or some specific areas, they will not be able to afford it. They will not be able to pay for their glasses. So a glasses you probably buy, let's say in Nigeria for a cost of um I'll say it in naira and in pounds so you'd understand clearly. So in Nigeria you probably buy it for the cost of 70,000 naira. So in pounds they are paying the sum of let's say 400,000 for that same glasses, that same equivalent. So the cost of those assessing those things. So when they consider the cost of I have to spend so much to get my glasses. They will not get that glasses. So they rather just stay with the condition instead of paying for stuff like that. So they are different. And then also people like to stay in town. People don't like to stay in those rural areas. They're like, no, I want to stay in Cardiff. I don't want to stay in Tree Forest. And so those healthcare areas, they do lack staff. They do lack medical staff. So I went for a conference recently and there's an idea that we came up with. So there's they talked about training people in the community to work for the community. So for example, you see those rural areas where okay, there are children that can't even afford this education, or there are people that really want to go to school but they do not have the money to afford this education. So there was a thought of what if we sponsor them, you sponsor these people to train and then work in the rural area. They don't have to work for in the rural area all their life. It could just be a period of 5 years post study, just to give back to the community that has helped you get to that point. So those are some of the methods they taught about to keep people in the rural area. So they are helping them, they are investing the community money or all the money they could gather to send people to school. They're not saying you force them to stay there all their life, but just to contribute or train other people that will be willing to come back into the rural area and help us to also improve healthcare and people accessing specialists that they need for their care. Okay, so that is my contribution, and thank you so much, everyone. So before we round up, I'd like to give Amber the opportunity to talk about rural seed and our current what we're working on, probably the guidebook or anything you want to talk about.
So Rural Seeds is a global network for healthcare professionals and community members in rural areas. So the idea is that we pair people who are interested in working in rural healthcare in particular, with people who are more seasoned and experienced with working in rural areas. So for example, we have a lot of people who are professors, retired GPs, and we try and pair them with students or people who are currently training in the medical field in rural areas to provide a bit of support and to try and improve some of the inequities that we experience, particularly with training, but also motivating us to help improve the quality of life for our patients in rural areas. So ways you can get involved We have a website that has a list of all our projects, ruralseeds.net. We have a Facebook page and we have a YouTube channel. If you type in Rural Seeds or Rural Family Medicine Cafe, then we'll come up. Our next cafe will be an in-person one at the Ubuntu World Rural Health Conference in South Africa in about a week's time. We would love to get participation from lots of different healthcare specialties. Initially, when we started, it was just doctors, but we recognize that rural communities don't need just doctors, they need everyone. And we're also working on a rural guidebook. So this is a guidebook for healthcare professionals who want to improve their advocacy skills when it comes to training and education. So me being a family physician, when I came back to the Virgin Islands, I wanted to help students who were in primary school and high school and wanted to also become doctors in the community, support them on their educational journey. But there wasn't really any information on how to do that. And the government here was not very supportive. So this guidebook is designed to help healthcare professionals do exactly that, try and get into schools to get students interested so that we can get more people coming back to the rural communities that they come from. You're muted.
Yeah, no, okay, I don't know why I keep doing that. Okay, so sorry about the way I keep forgetting to unmute my mic. Okay, so does anyone has any contribution or questions, anything you'd like to ask about rural seed or healthcare in general? Any questions at all before we round up?
Am I permitted to speak?
Yes, you are. Come on.
All right. There's actually been an educative section, but at the same time, this might sound funny, but why are present here today? Is it just to get information, or is there any goal that you want us to do, or it's just for us to just interact for interacting's sake? So I actually want to know that. Probably after then I could ask any other question.
Okay. Sorry, that was my error. I should have said this at the beginning. I don't know how I skipped that. Okay, so the aim of this session is to garner ideas that we could use into implementing a change in the rural area. So gathering your ideas, what you think we can do at the community level. So for it's just like the conference I went for. They are thinking of these ideas came from the conference. So they are getting these ideas to they want to try and train people in the community to get them to work back in the community or give back into the community. So those are the ideas they got from the conference. So the aim of this session was to garner ideas that can possibly be impactful in our planning towards improving the rural health in rural sectors of the society. So gathering these ideas now, we can probably now sit down together and think about, okay, how can this work? This is the plan that came up. This is an idea that has been brought up. How can we implement this? How can we do this? Okay, saying, okay, is he planning a community outreach? Since from experience, you think the community outreach works and you've had experience with this. So now we can sit and think about a plan towards doing a community outreach that can help that community or that can help a specific community, not it might not be that can help a community improve their rights, get access to rights, get in anyway. So that's why this discussion was. That's why we had this discussion. Okay, Amber, yeah.
I also wanted to add that this discussion, we've recorded it and it's going to be included in the Family Medicine Cafe YouTube page, which, you know, we have a quite a regular membership that follows it. But it's important, especially because rural communities tend to have more in common with each other than with their urban counterparts, that we share this kind of information. Because, for example, I would never have known about the kidnapping situation in Nigeria if one of you didn't tell me. I would never know, even though I'm in the Caribbean, right? But that information is important to me in a rural setting. Why? Because our economy is not that well either. Perhaps in the future, we will encounter exactly the same problem that Nigeria is having right now because we're still a rural community. Thankfully, we're small enough that crime here is pointless because we all know each other, literally. It's 1,100 people on this island. So, but it's something that we do have to think about when we're planning for the future of healthcare. You know, if we're going to expand our health services, yes, it's great to do outreach and education and all of that things. But if we can't guarantee that our physicians will be paid a competitive salary, live in a safe area, that our police will respond if there's an emergency, we have a lot of human trafficking in the Caribbean because of all the little islands spread out. It's if someone decides to kidnap me and put me on one of the uninhabited islands, no one will ever find me, you know? And these are the things that it's good to start thinking about. So although it might feel like we're not getting a tangible result right now, I think actually this is the beginning of something very important in terms of our professional development and also strategic planning. Because now we have shared ideas and experiences with other people. It can help us with our present, but also with our future.
Thank you. Thank you so much, Amber. Akiri, the star. Okay.
Yeah, I think that actually goes a long way. It goes a long way to answer that part of the question. Then, secondly, if is a big statement anyway.
Okay.
So if I decide that, all right, fine, I want to work with Seed, or I want to partner with Seed, or I want to be a member, how possible is that? Or are there restrictions, are there limitations, or are there anything you need to qualify? You know, just stuff like that.
You want me to answer?
That's fine. You can go ahead.
So, because we know that rural is difficult, we've made it as easy as possible. So there is no minimum requirement. There's nothing like that to join Rural Seeds. You can sign up to our mailing list on the website. We are a very project-based group. So if you have a project idea, like let's say, for example, you want to come up with webinars to educate family physicians about eye problems, or you want to do outreach to get people interested in doing optometry in rural areas, you can organize that through us. That's not a problem. You can organize a rural cafe. You can partner with us to do workshops. You can literally just send out an email on our group and we will try and facilitate and connect you with the right people as much as possible. That's the whole point of Rural Seeds. We're trying to network people who may not have met each other before. One of our biggest motivations was actually because conferences are so expensive. We try and use social media and other ways of networking to get people to talk to each other.
Thank you, Amber. Thank you. And then there's also the opportunity to apply to be a Rural Seed ambassador. So I'm currently the Rural Seed ambassador for Nigeria and Wales. So I think it comes up every 2 years. I'm not sure, but so I think it's gone out. I think the next one is probably next year, or I'm not quite sure, but it's on the website. Yeah.
Do the call out in November, and it's with a view to start in January next year.
Okay, so yeah, so you can have the opportunity. With that, you get to go to conferences. Like right now, they are going to a conference in South Africa. They went to Dublin the last time, and sometimes they do they do have sponsorship for some of these conferences to sponsor you. Like those going to South Africa right now, they are being sponsored to go to South Africa for the conference. I'm not going to because I couldn't make it.
So yes, you do get opportunities for scholarships to go to conferences. You also get support from us with abstracts and research papers. There's opportunities to join existing research papers. Like a lot of the ambassadors from the last cycle would have gotten to co-author a paper with the World Health Organization. We also help each other. So like the conference in South Africa, because I'm retired now, I booked a villa for all of us so that the current ambassadors wouldn't have to pay for their accommodation. They can just join the villa that I've booked for them. So it's definitely a worthwhile venture. And you get priority for anything rural. You get the first call if there's an opportunity to speak. Like 2 of our ambassadors are actually doing a speech before the keynote for the rural health at the World Conference. So there's lots of benefits.
So yeah.
You said you are retiring. Why are you retiring?
Because it's stressful. So I've been in this role for 6 years and I have attempted to retire twice. So but there's never been enough people to take over the work that we've been doing. So after 6 years of attempting, I am now officially retired.
Why do you feel so happy? You shouldn't be. You're leaving us.
I know I'm happy, right? Because of the added responsibility, having to do the meetings and getting the emails,
Yeah.
and I'm
I'm
happy
I'm
to
I'm
help.
I'm quite keen on the research aspect of the on the research aspect. I'm quite keen on that because I'm more into that anyway. I think that's something I think that's something I'll be very much interested in doing.
Okay.
We
All right.
have
So the
recently had a request for paper. So if you have something that's in the works and you need help finishing it, just let me know.
Oh, all right. All right.
okay, so the links have been dropped on the chat, so you can click on any of the link to get in touch with us, send us a mail. They will respond to you as soon as they can. Okay, so finally, thank you so much. Thank you everyone for honoring our invitation and joining in. I really do appreciate it. Thank you for your contributions and your ideas. Thank you so much. So, and with this, we say goodbye. Thank you.